Hello, Happy New Year.
Hello, everyone. We'll get started in just a minute. All right. Hello, everyone. Welcome to the January meeting of the Endometriosis Working Group. Just checking. We are joined by CTN today, and I see a number of you, which is fantastic. Today's going to be a shorter meeting, but wanted to do a check-in with folks. Why don't we go around, though? I think it's always important to do introductions. So I'm Jillian Gilchrist, State Representative out of West Hartford and Chair of the Working Group. Arlie, could you jump right in?
Hi, I'm Arlie. I am Miss Endo Stud, and I am located down in Fairfield, Connecticut. Nice to see everyone today.
Nice to see you. Beth?
Hi, I'm Beth Ludwig, and I am an Endo mom. Happy to be here. Thank you.
Wonderful. Carolyn?
Hi, my name is Carolyn. I am the program director or director of community health programs at EndoFound. I manage our school and college adolescent health education programming.
Fantastic. CM Dumas. Oh, you're muted.
I'm Carla. I'm Caroline Haney's mom. I'm recently retired and she encouraged this. So here I am.
Wonderful. Glad you're here. Thank you. Dr. Courtois.
Hello. Hi, I'm Elise. I'm a researcher at the Jackson Laboratory. So researching endometriosis and also one of the co-director of EndoRise.
Wonderful.
Happy New Year.
Happy New Year. Iris.
Hi, my name is Iris Smith. I'm a staff scientist at the Cleveland Clinic and an endometriosis researcher, as well as a patient.
Wonderful. Thank you.
Wow.
I muted myself. Sorry. Izzy.
Hi, I'm Izzy. I work with Carolyn at the Endometriosis Foundation as our program coordinator.
Wonderful. Janet.
Good afternoon, Janet Stolfi Alfano, the CEO of the Diaper Bank of Connecticut and the Connecticut Alliance for Period Supplies.
Wonderful. Jasmina.
Hi, everyone. I'm Yasmina Fidancic. I'm the program manager for Endorise based in Farmington, Connecticut.
Great. Lisa.
Morning, everybody. Oh, it's good afternoon. So you can tell how my morning's gone so far. Good afternoon, everybody. I'm Lisa Roy. I'm Director of Government and Community Relations at the Jackson Laboratory. I support the Endorise team and all y'all really in the legislature.
Great. Thank you. Marge. You just have to unmute, Marge. I don't know if we can do it. Brianne, are we able to unmute Marge?
I can ask her to unmute, but I can't actually do it.
Okay. Marge, I'm going to keep going while you try and figure it out, okay? Sam?
Hi, Endo Warrior, patient advocate, and I am based in Quaker Hill, Connecticut. Happy New Year.
Wendy.
Sorry, multitasking. Good morning. It's Wendy Bingham. I represent extrapublic.rare. I'm a patient and a nonprofit organizer and somebody who delves into research. So thank you for having me here.
Thank you for being here. Marge, go right ahead.
I guess I'm unmuted because had to do with audio. Imagine that. Okay. I'm amazed at all of the things that have been happening here since I originally joined a long time ago. I've been a sufferer for too many years to count. And I just love coming to meetings when I can make them.
Well, we're so glad you're here. Thank you.
One of these days, I'll figure out how to manipulate all of this stuff that has to do with computers.
I think you're doing a pretty good job.
Oh, thank you.
You're welcome. Bob Cosienda can't go off mute, but he is here and he represents the Center for Youth Leadership in Norwalk and the Mayor's Youth Leadership Council in Stamford. Thank you for being here. We also on to Kara.
Yes, hi, Kara Andrioli. I don't know why. Oh, there we go. Real picture. I'm a registered dietitian in Glasgow, Connecticut. And I've recently created a nice guide of nutrition for patients. It's going to be posted on the EndoRise website very soon, and it will just be a very nice source that helps patients, kind of find joy in eating, because we know that since this is an immune system disorder, that food can really help it.
Fantastic. Yeah.
That's part of the process.
Wonderful. Thank you. Sorry, you went in a little.
Yeah, no worries.
Heather, go right ahead.
I think Heather stepped away briefly.
Okay. Joshua.
Hello, everyone. My name is Joshua. I'm a PhD student in Dr. Elise Courtois' lab studying endometriosis. Sorry, my camera's not on, but happy to be here.
Glad you're here. Laura.
Hi, my name's Laura Milnick. I work at Yukon Stores. I had nothing to do with research. I am a patient and a sufferer, but I'm very thankful for this group. Thank you.
Thank you. Heather, go right ahead.
Hi, everybody. Sorry to be popping in and out like that. Heather Guidone, Center for Endometriosis Care, working group member. Happy New Year to everybody. Glad to see everybody. Great to be here.
Wonderful. Thank you. Did I miss anyone? Because I'm on my phone and things bumped around.
Yes, it's Lauren Cornegay from Enzo Black Incorporated. Hello, everyone. Happy to be here.
Thank you so much. Sorry about that. Anyone else that I missed?
I jumped on late. I'm Caroline. I'm a postdoctorate associate at the Jackson Laboratory. So I study the underlying biology of endometriosis. And something I haven't shared on here yet is I am actually having my first surgery next week.
Okay.
Yes.
Thank you. We will all be sending very positive thoughts your way. Wonderful. Well, that's a great transition. As we always do, I'm going to give some space. Is there anyone who would like to share their experience with endometriosis? Yes, Iris.
I shared a little bit last time, but I do want to just emphasize, I think it was Jasmina. I apologize if it wasn't Jasmina. But this disease is definitely an autoimmune disease, and the decades long of being a survivor and a warrior of endo really takes a toll on women. So I'm just glad that I'm a part of this effort. It's amazing.
Wonderful. Thank you so much. Anyone else?
I'll share. I feel like I haven't shared my story in a little bit. So I'm Arlie. It took me 24 years to be properly diagnosed. I then had frozen pelvis after two surgeries with non-specialists. I've had a total of 5 surgeries. I was put into surgical perimenopause and then surgical menopause, stage 4. And I unfortunately am still living a life of chronic pain and issues because of the delay of diagnosis and surgery without specialty. So anyways, I'm super happy to be here and patient advocate and happy to support people in any way I can through my own experience. So thanks for letting me share.
Thank you, Arlie. All right. I don't see anyone else. So thank you all so much, and thank you for being here. We will move to the first item on the agenda, which is a policy update. Wanted to let folks know, last time we discussed a little more in depth Connecticut's current policies regarding health education. And so many conversations over our years together now about the need to get education across the board, but in particular into the schools. And so Arlie and I do have a meeting scheduled with Representative Jen Leeper, who is the co-chair of the Education Committee, to discuss a potential proposal that would build off Connecticut's existing law regarding teaching students about disease prevention and awareness. And we are going to see if that could be could it be placed there? So we'll keep you posted on that. Another conversation we had, so for folks who aren't aware, our first year out of the gate, the endometriosis working group was able to work with the state's Department of Public Health and pass legislation that requires continuing education for our physicians with regard to endometriosis. I'd love to say, yay, we solved the problem. These are all tools in the toolkit. It is optional. They can choose to do that particular continuing education, but still, okay, right? A step in the right direction. What we are asking now is, what we've been told is that there aren't too many professions who are mandated by state law to get continuing education. And so I believe I mentioned to this group this magic department we have at the legislature called the Office of Legislative Research. And so I have put in a request to them and just waiting to get that information back. They're just pulling for us what other professions are required to get continuing education, because then that can guide our next steps in terms of potentially requiring endometriosis to be a piece of that. So we should have information on both of those pieces for our February meeting, at which point I would like us to kind of formalize our policy recommendations. Again, in Connecticut, the legislature is going into what we call our short session. We go in February, and that's when all the committees do their work. And then we have to vote on bills by May. So ideally, we would develop our priorities in February, get those over to the respective committees. As you see, we're already doing some of the groundwork. And then this group decided we thought it would be best to do kind of a press conference and advocacy day in March to push for those proposals and raise awareness about endometriosis. So I kind of hit two pieces of the agenda, and I did mention need this to be a shorter meeting, but happy to stop and hear from folks. Any questions on any of what I just mentioned? Okay, I am not seeing any hands. All right, then I am going to go off camera and go to our next piece of the agenda, which is an update from EndoRise.
Hello, can you see my screen?
Yes, we can.
Okay, so going along with the shorter meeting, our presentation is very brief today due to the holiday season and our last meeting. We just have a little brief update. For the biorepository, we're happy to share that we have surpassed our 100th participant that's been enrolled into the study. So it's a huge accomplishment for us, yielding close to 5,000 biospecimens to be distributed to advancing research on endometriosis. And with that, we have our first distribution plan for next week to a startup out of Boston. They're doing some amazing work on endometriosis research. So they'll be getting their biospecimens from us. We submitted our legislative report to the Connecticut General Assembly Public Health Committee at the end of the year, so end of December. And we are happy to share that we have finished all the paperwork required to start collecting biospecimens from Trinity Health. And we plan to start collecting in the beginning of February of this year. We had a great article feature from the hour from patient to researcher. This is focused on the work we're doing here in Connecticut. And in the article, Dr. Elise Courtois and Caroline Haney are featured. So it's a great read for anyone interested in learning a little bit more. And that's the link. And also, if you scan the QR code, it will bring you straight to the page. And like I said, it's very brief. We have some exciting things coming up in February and March, but happy to share. We'll be sharing that at the next meeting. And once again, please connect with us, reach out to us for any resources or any recommendations that you have via our website, Instagram, or LinkedIn. Thank you.
You weren't lying. Thank you. Any questions or comments? Thank you for your continued amazing work.
Thank you all for your support.
Because that's the other thing I will flag for folks in like policy land is we did learn last. So right now, the biorepository funds for EndoRise fall under the Yukon Health line item in our state budget. It was recommended to us that we actually break that out so it's its own specific line item in their budget. And so we will be working on that piece as well, just to keep everybody in the loop. Okay, well, it was a quick one, but I wanted us to touch base because I think it's important for us to get together. We'll meet again in February. Our next meeting is scheduled for, we usually, let's make sure. Yes, February 9th would be our next meeting, 1 to 2:30. Okay, looking forward to seeing everyone. If you need anything in the meantime, always feel free to reach out. Thanks, everyone.
Thank you.